The news that Donald Trump received an updated COVID-19 booster shot, along with his annual flu shot, specifically in preparation for upcoming international travel, is a significant event that highlights the complex intersection of personal health, public policy, and political messaging surrounding vaccines. Analysis and summary of the event. The White House physician announced that President Donald Trump received an updated COVID-19 booster vaccination as part of his ongoing health maintenance plan and in preparation for international travel. This news is notable given his administration's support for a new CDC policy that had recently narrowed the broad recommendation for COVID-19 immunization, shifting it to a shared clinical decision-making process, mainly for those under 65 and without existing high-risk health conditions. Trump, who spearheaded Operation Warp Speed to accelerate vaccine development, has consistently taken credit for the creation of the COVID-19 vaccines while simultaneously fueling vaccine skepticism, particularly toward mandates and broad public health guidance. His previous decision to receive an initial booster dose in private and a subsequent disclosure that drew boos from a crowd underscore the deep polarization of the vaccine issue within his political base. Reasons and consequences. Reasons for taking the shot. Pragmatic health requirement. At 79, Trump falls within the age group 65 and older that remains explicitly recommended for the updated COVID-19 vaccine, aligning with the FDA's current focused approval. The primary stated reason from his physician was preventive health screenings and immunizations ahead of international travel. International travel often increases the risk of exposure and may necessitate certain immunizations for entry or for personal safety in high-exposure environments. Personal health precaution. Despite public health skepticism, the act is a personal acknowledgement of the medical benefit of the vaccine, particularly for an individual with prior COVID-19 infection and age-related risk factors. Symbolic political balancing act. The public announcement, framed as routine, pre-travel medical care, allows him to simultaneously claim credit for the vaccine's existence, Operation Warp Speed, and demonstrate personal medical freedom by taking the shot while his administration maintains a policy of restricted recommendation and opposition to mandates. Immediate consequences. Criticism from opponents and supporters. The announcement drew immediate criticism. Opponents highlighted the perceived hypocrisy of taking the shot after fostering an environment of vaccine skepticism. More significantly, some ardent supporters and anti-vaccine advocates expressed backlash and confusion, viewing his decision as a contradiction of the rhetoric promoted by high-profile figures within his administration, such as Health and Human Services Secretary Robert F. Kennedy Jr. Spotlight on vaccine policy. It refocused attention on the administration's recent changes to the CDC's vaccine recommendations, which had been criticized for showing an official lack of confidence in the safety and efficacy of the vaccines for the general population. Reinforcement of political identity and health. The physician's memo also emphasized Trump's exceptional health and younger cardiac age, seeking to preempt health-related political attacks ahead of his travel and re-election campaign. Predictions and solutions. Political and public health predictions. Continued politicization. The announcement will likely do little to bridge the gap between vaccine advocates and skeptics. The underlying political correlation between Trump support and vaccine hesitancy, established during the pandemic, is deeply entrenched. Skeptics may rationalize his shot as a requirement for travel or a personal medical decision, not a blanket endorsement, thus maintaining their resistance. Increased scrutiny on global health policy. The focus on international travel may lead to greater scrutiny of his administration's approach to global health institutions like the WHO and vaccine diplomacy, especially in light of past executive actions that have impacted foreign aid and global health security. Ambiguous effect on vaccine uptake. Historically, when Trump has publicly supported the vaccine, it has been shown to increase vaccination intention among his voters. However, this effect is often limited and complicated by his simultaneous anti-mandate and skeptical rhetoric. The net impact will likely be minor and localized, primarily reinforcing the existing pattern where political alignment remains the strongest predictor of vaccine behavior. suggested solutions for public health messaging. To mitigate the confusion and address the underlying drivers of vaccine hesitancy, public health officials and political figures could adopt several strategies. Depoliticize the messaging. Separate public health communication from political figures, relying instead on trusted, nonpartisan local doctors, community leaders, and scientists to deliver consistent, clear information. Emphasize personalized risk. Frame the vaccine decision as a personalized risk assessment and part of routine preventative care, which aligns with the shared clinical decision-making approach and is less likely to trigger political resistance than blanket mandates. Address foreign travel as a universal health precaution. Use the travel preparation narrative to normalize the concept of vaccination as a necessary precaution for international movement, a universally accepted practice for other diseases such as yellow fever or typhoid, thereby subtly reinforcing its medical utility. Focus on traditional vaccines. Given that many COVID-19 vaccine skeptics still accept traditional childhood vaccines, public health efforts must draw a firm line of distinction to prevent skepticism from migrating to established life-saving immunizations. Read aloud voice output.